Good afternoon. This is a continuation of the Metro Council Budget Committee hearings on the FY22 capital and operating budget proposals for Louisville Metro. Today is Monday, May 17th. It's 4:46. This is the third part of today's hearing. We'll be discussing the Office of Safe and Healthy Neighborhoods proposal. On the call are I am the committee chair, Bill Hollander. Also, these council members are present with us. Armstrong, Fowler, President James, council members Purvis, Arthur, Kramer, Parker, Winkler, George, McCraney, Engel. I believe that's it. Councilman Piacentini has an excused absence this afternoon. Again, we're talking about the Office of Safe and Healthy Neighborhoods. The director of the office since September 2020, first time in a budget hearing with us, is Monique Williams. Ms. Williams, the floor is yours.
Thank you. Can you hear me?
Yes, we can.
Okay. Monique Williams, Director for the Office for Safe and Healthy Neighborhoods. So the pandemic really presented us with some challenges last year that exacerbated instances of violence in the city. And I mean, we weren't the only ones. Several other cities saw unprecedented and unacceptable violence and crime outcomes that, we don't want to see again. And unfortunately, even with the significant increases we've seen across the country as a whole, Louisville was still an outlier when you look at the rate increase of violence and homicide. And our increase was almost double the average rate of other cities. And so for us, we really got to ask ourselves why and look at, what is required for reimagining how we do public safety as a city. If nothing else, the pandemic really did illustrate for us how much of a public health issue violence is and how a public health response is needed to address the issue. And so with traditional public safety, we have a crisis of police community legitimacy, and we have to address that. And so the conversation and strategies for violence prevention have to expand beyond enforcement because they can't do everything that needs to be done to effectively address this crisis. And so we know that factors at multiple levels interact to influence behaviors and produce specific outcomes. And so we have to align ourselves with that research and with best practices for violence prevention that really center around a more holistic approach. And so the public health approach emphasizes the input from diverse sectors and systems, including our healthcare system, our educational system, social services, the justice system, policy, private sector, local, state, federal government. Kind of that collective action on the part of all of the stakeholders is what helps with this issue because it's so complex. And so producing safety really requires a whole of government and a whole of city approach. And the city has chosen to accomplish this by investing in the specific strategies that I will pull up for you now. Oh, I don't think I have the ability to share my screen. Somebody give me that permission. Okay, I have it now. I think I have it now. Okay. Can you all see this? Okay, you see my screen?
Yes, we see it. It's actually in the present. It's not in the presentation mode.
Now can you see it? Okay, so we're looking at the city as kind of reimagining public safety through the specific strategic areas of community mobilization, prevention, intervention, enforcement, organizational change and development, as well as reentry. And so we know at this point from decades of research and from what's been captured via major news articles over the past year that the most effective way to address community violence is to coordinate a comprehensive community-based strategy through a citywide infrastructure which links to public health, economic development, public safety, and community-based agencies. And we're able to do that via these strategic mechanisms, and you'll hear from varying agencies over the next couple of days as they discuss their specific role in Louisville's system of public safety. And so as we're reimagining public safety, we have to make sure that it includes, especially in historically marginalized communities, supporting venues of engagement for communities to participate in shaping what public safety looks like for them, which happens through community mobilization. We have to provide resources to address critical social problems like police community relations, access to housing, access to gainful employment, food insecurity, the built environment for certain communities, transportation, healthcare, all of that, all of those things fall under the prevention category. We have to support evidence-based community-driven models for violence intervention that balances both support and accountability for those engaged in intervention efforts, including accountability for those who choose to engage in harming the community, whether that be a general community member or law enforcement. For organizational change and development, we need strategies that deal with policies and practices and norms that are conducive to creating environments that accept or condone violence or inequity. And lastly, we need a solid reentry system that supports the needs of the community out of the criminal justice system to lessen the likelihood of individuals reoffending. And so Ocean over the years has engaged in efforts across all of these strategic areas. And for the sake of time, I'll leave the discussion of those things to specific questions, but I do want to briefly touch on the proposed budget before you with, based on what we've seen in the last year and what we're seeing in this year, we are in a state of emergency as it relates to our gun violence that's happening. And we need to be able to not only respond to, but get ahead of what's happening in our city. And as we look into the proposed budget for next year, we're reorganizing and expanding strategies in areas that will help build necessary infrastructure for violence prevention and intervention. And we're looking at doing so through the building out of a community outreach and support network system that will be based in the priority areas of the city. And so through this outreach and support system, we'll deploy three main strategic initiatives, that being the Pivot to Peace initiative, which will coordinate the efforts and outcomes for our evidence-based models for gun violence reduction, inclusive of our hospital-based intervention strategy, our outreach initiatives, that being the Pivot to Peace initiative, which will coordinate the efforts and outcomes for our evidence-based models for gun violence reduction, inclusive of our hospital-based intervention strategy, our outreach and intent are grounded in the public health approach. I'm going to stop my sharing and I can take questions.
Okay, thank you. First of all, I would ask that you send that PowerPoint to us, to the Metro Council clerk. We'll make sure that it gets added to the agenda so that it's visible to the public, and also so that we'll see it. There was a lot of print there. It was a little hard to see on the presentation. Let me ask you some questions about the budget, and particularly the increase in the budget. It looks to me, in looking at the budget, that a significant portion of the increase is not new Metro employees, but instead payments to contractors. Is that right?
So there are some new positions for the office to infrastructurally, be able to support what we're trying to do with the initiatives. And that exact breakdown, I believe that Daniel may have that's going for the specific initiative that we're talking about, but there are some infrastructural things that are needed within the office that will require us to increase our staffing.
Okay. Daniel, do you want to comment on that?
Sure. Sorry, I have an echo now.
We hear you. You're muted now, Daniel.
laid of the projects that are for reimagining public safety relate more to contracts and some of the capacity building that we have, including place-based violence prevention strategies and some of the investments in pivot to peace.
Thank you. Director Williams, do you know what process you would follow to select contractors? This budget's approved. It looks to me like there's an increase in, I don't know, $2.4 million in payments to contractors as part of this. What process would be followed to select contractors and award those contracts?
So I believe that there is an internal process for when we have to go through a competitive process, but more so focused on the agencies and organizations that we know do the work, whether that's here locally or we're contracting with individuals who are providing consulting support for the work. And some of what's been allocated within that amount also is funding for like an external agency fund. And so for that, there will be a creation of an RFP process to support the work that we're trying to do within that for those organizations. And so that's how that portion of the funding will be managed. And then outside of that, it's the Metro processes for identifying, kind of best practices or whatever the process is for identifying the most, rigorous individual or organization to support whatever it is we need them to support relative to each individual strategy.
Okay, just one final question, and I'll pass this off to someone else. And this may be a question for Daniel. But to what extent do we think that some of this increased funding is a potentially could be funded with ARP funds? I mean, I know that the guidance that we've received from the federal government specifically mentions violence prevention strategies as an allowable use, at least in some cases. Are we looking at that currently, and will you have a recommendation on that at some point in the future?
We are looking at that. We've reviewed our FY22 budget proposal relative to the interim U.S. Treasury guideline. And so, as you mentioned, some of the violence prevention initiatives are potentially eligible. The question is, are they on the spectrum of 0% eligible to 100% eligible? Portions may be eligible depending on what the function is and where we're spending the funding in terms of, for example, location and census tract and so forth. That's true of much of the budget that we're evaluating, where it seems like it may be eligible, but it may not be entirely eligible. Portions of it may be, and that's where we'll have to kind of marry up the rules with the programmatic expenditures.
Okay, thank you. And I know that work is going on. I think that's important, and it's not just in Ocean's budget; it's in a number of other budgets, department budgets as well, so that we can look at potentially using some ARP money in substitution for some of the general fund appropriations. Councilwoman Purvis.
Thank you, Mr. Chair, and thank you, Ms. Williams, for being here. In your presentation, you mentioned a reentry system. So I wanted to know if you could elaborate on that. What type of resources was your department going to be focusing on? Are we talking about education, job training, and are you looking to partner up with any other agency or organization to make this happen? And does this include expungement?
Sure. So I'll say that within this budget for us specifically, so this is just like the entirety of the strategy for the city's public safety initiatives. And within that strategy, we used to kind of facilitate some direct reentry programming. And so right now for us, that would be more so with the external agency funding to support individuals who are doing the reentry kind of work. And then also looking at an increase of supporting specifically reentry with our partnership with the Urban League, as we've had discussions about what that previous allocation has been able to do and what they would need to better be able to support that particular program.
So this would or would not, or right now you don't know if this would include expungement?
This will include expungement. I'm sorry, we previously funded the Urban League's expungement program, and so we're looking to increase our contribution to that funding.
Great. Okay. Thank you.
You're welcome.
Councilman Arthur.
Peace, Doc. Thank you for being here. What's up, Chief James? You know, I love how your office takes this holistic approach to violence prevention. When you look at a map of unemployment in Louisville, poverty, extremely low income, housing instability, it's all very much so concentrated in the West End. And when you also look at maps of homicide and shootings, it's all concentrated there as well. There's a direct correlation. Could you speak to collaborations with other city agencies, other city departments that are currently happening, and any new ones that you anticipate happening in the fiscal year coming up?
Sure. So traditionally, I mean, we have lots of partnerships across agencies, interagencies, where we have partnerships and engagement with LMPD. We have partnerships and engagement with RCS and the Office for Youth Development. We're looking at outside of our agency, we've historically partnered with the Urban League and Restorative Justice Louisville, now Volunteers of America. And I mean, Chief James could maybe speak more so to some of those agencies from the past years. But moving forward, some of those same agencies are at the table, but also looking at engaging more so with some of our grassroots organizations that we know are doing the work, who just don't have sufficient support to be able to show efficient outcomes to go along with those efforts. And so how do we build capacity in those spaces to help get them to a place of being able to express more effectively how much they are being effective in community, as well as, I mean, our partnership list is like over 72 agencies. And so even within our community advisory board, which is being reactivated, it's kind of cross-sectoral, right? So we have some private sector organizations and businesses. We're talking about JCPS. We're talking about those that support the behavioral health and mental health sectors. So 7 counties and NAMI, and even some work with the Black Lives Matter organization as far as the work that they're doing on building healing and trauma in community. So there are a plethora of organizations that cut across multiple sectors that are at the table right now.
Do you know, or does Chief James know if the Office of Housing is on that list?
So are we talking about Metro Housing Authority?
No, Office of Housing with Marilyn Harris.
No, we haven't had any direct partnership with the Office of Housing. We do have a partnership with the Housing Authority. We have received 10 vouchers from the Housing Authority to be able to work with our outreach team as they're encountering individuals who've experienced violence, that we can potentially relocate them into other areas of town that would be safer for the families.
Okay, I'll hit you up offline. Just want to suggest and just really motivate us as we think about that holistic approach. I know you mentioned housing earlier at one point. You know, they are working on housing. They're doing all the rental assistance, and knowing that if you have unstable housing conditions, then it's going to lead to everything that we're talking about right now. So I'll hit you up and hopefully we can make that collaboration happen in the new fiscal year.
Absolutely.
Councilwoman Parker.
Yes, thank you, Mr. Chair, and thank you, Ms. Williams. With this agency, I think we all know that if you look at the crime reports that we get in our inboxes every week or so, statistics show that our homicides have quadrupled in the last 10 years. And just let me preface, I've got 2 questions. This first by just noting that about 15 years ago, New York City, they had a problem with crime and homicides of about 3,000 a year. And with the programs they instituted, they took their homicide rate down to about 300. So, and that was before anyone had ever heard of Reimagine programs. So I'd kind of like to know what's your goal percentage wise of reducing homicides with some of these programs? And some of these programs we instituted like last year, the year before, but I'm sure that we're going to beef them up on steroids now. But just so as a tool for measurement of how we're doing and if we're moving the needle, what's your goal percentage wise? So a year from now we can come back and see how we're doing after we institute some of these reimagined programs.
Sure. So I'll say this about New York, because they are, one of the partners that we are in network with. And when we're talking about reimagining public safety, they were already reimagining public safety a while before us. And so they have a robust crisis management system and a robust violence reduction strategy system that is inclusive of some of the things that we would just be beginning to infiltrate. And overall, their public safety strategy, there's almost $70 million that's put towards it. So they've made significant investments in that way for their public safety strategy. And as far as our percent wise, that's tougher. And I'll say that we can put forth a number, but in honesty, that number would be a little bit arbitrary, because what the evidence shows is that you implement the project, and based on what you're able to implement with the resources that you put forth for implementation, that directly impacts the kinds of outcomes. Now, we know when we're talking about the specific gun violence reduction strategies, with each one of them in the evidence base and in the evaluations that have been done, you could see between a 20% or a 70% reduction within a year. And so our hope is to reduce as much as possible. And if we need to put a number there, we can put a number there percentage wise. But if we reach that number, there are multiple factors that contributed to it. And we would like to say we were, the ones who caused it. But if we don't meet that number requirement, we're still not wholly responsible, because even as you can see from the strategy, there are multiple people that play into public safety. Now, what we're looking at specifically with our gun violence reduction strategies are a reduction in shootings, a reduction in homicides, and a reduction in recidivism rates. And one of the reasons that we're coordinating all three of the efforts that we have that are known in the evidence base for gun violence reduction is so that we can more holistically look at how we're doing as a city in our deployment of those initiatives. And so all of the data for those initiatives being pulled into one space and one data center, and everybody is putting their data in one space, and we'll be able to get at kind of what you're asking about, and we'll be able to show it. There's just no metric for me prior to provide you with the evidence shows that if we do, GVI in this way, or if we do strategic case management in this way, you're going to see a 10% reduction next year.
Okay. And then do you have a plan on, or a backup plan on what you'll do or what you can change if crime still continues to go up?
So if crime continues to there are lots of things that are happening, right? And there are lots of things that are facilitating the crime that we see. And so I think I heard Dr. Moyer speak to this, but, there were issues that we had, and then the pandemic exacerbated it. And so there are things that we sometimes can't control as it pertains to what causes the effects. And so we had multiple crises converge at one time. We had a pandemic happen, and then there was the economic downturn because of the pandemic. We had racial injustice happening with civil unrest in our city that caused a lot of disorganization. We sit in a place where we deal constantly with structural violence issues that created the conditions in which we are facilitating these initiatives because of. So there are a lot of things that are happening at once. And we don't have control over all of those. I can just say from what we have and for what we will do most effectively and efficiently with what we are given, and utilize what we know to ensure that our numbers are going down.
Okay, well, thank you. Hopefully our downturn is over with and the pandemic is almost over with. So we won't have as many issues to deal with going forward. Thank you.
You're welcome.
Councilman Winkler.
Thank you, Chair Hollander, and Monique, thanks for being here. I want to first sort of piggyback off Councilman Arthur's comments. I agree with him completely that in order to address sort of the root causes of crime, we've got to have a holistic approach and think that, multifaceted solution that focus on economic opportunities, diversion programs, reentry programs. I think those are key, and look forward to the work that your team and others across Metro will be doing over the next year, because the challenge that we have is one, that's not faced by any one department, it's faced by all departments and really all citizens of Louisville, and it's incumbent on all of us to work to resolve it. I have two questions for you. The first one that I want to ask is, I know a lot of the challenge that we've had in the past with some of the programs that have been administered through Ocean have been oversight related. And so what processes do we have in place to ensure the proper execution of the programs, and that we don't repeat the administrative mistakes that have been made in the past?
Sure. So I'll say this from my perspective, and then I'll let Chief James talk about what may have been missing before. But I know one of the things that I can identify about the work that we do is, even just as an office infrastructurally, not having certain things in place to be able, or even certain positions in place within the office to be able to most effectively do some of the oversight that you're talking about. And so needing people within the office space to ensure that individuals are, compliant, and ensure that we're able to do, site visits and the different things that help with the oversight of the administration. And so just from a perspective of coming in and looking at, some of the places where the office has some lack, I think that was definitely a contributor to maybe the office's inability to respond in ways that were expected of it.
That issue you feel has been addressed?
I feel like it's addressed in this particular ask for us to have that infrastructure so that we don't fall into that issue.
Okay. Thank you. The second question I had, and maybe I'll ask it in two parts. What do you have a sense for what percentage of the violent crime that we're seeing in our city that you would attribute to, and I'll sort of broadly say, to youth sort of in general, right? And I'm not going to say 25 and under, 24 and under. I don't think it really matters. I mean, just sort of, but youth violence in general, like what percentage would you say is responsible for that? So,
I could gauge that number from LMPD data. And I can say that we, since the pandemic, have seen younger and younger people engaging. But even when we still look at our averages for victims who are victims of homicide and then victims who, non-fatal and fatal, that average age is still at 28 to 30. So we're having more and more young people, and probably if we continue without an intervention, that number would continue to creep and get lower. But as of right now, we're still at that, mid-20s age of individuals who are engaging. So it's critical that the strategies that we deploy are engaging them before that age range.
And so my follow-up question to that is, do you believe that the budget that is before us, holistically, not just with Ocean, but holistically, do you think that we are making an adequate investment in those youths to turn that tide?
Hey, are y'all done?
Councilman Parker, you're still on mute. Councilman Parker.
Parker, you need to mute. Thank you.
Thank you. I'll say that from what I see, we're investing in public safety like we haven't before, and significant investments here where we're dealing with young people who need intervention, and then also just in general youth development for young people that we're trying to keep from needing intervention. I think we're in a good place to make some dents in what we've been seeing and put ourselves on a trajectory of kind of decreasing what we've been seeing.
Perfect. Thank you. And I wish you all the luck in the world in the successful execution of these programs.
Thank you.
Councilwoman Armstrong.
Thank you, Mr. Chair, and thank you, Dr. Williams, for being here. So I just want to clarify some of the points that Councilman Hollander was making. So it sounds like a good chunk of this money is going to contractors, consultants, folks who are going to come in and help run some of these programs and interventions. Am I hearing that correctly?
Yes, from a kind of consultant basis, and then some of those who are contracted to actually do the work, yes.
And so I would imagine, and I just want to clarify that by funding some of these programs, sort of implicit in Councilwoman Parker's questioning was a recognition that these things take time to work. And so just to be clear, can you tell us sort of what your understanding is of what investing in these programs means? Sort of, are we looking at 5-year commitments here? How should we think about these programs and their role in our community? What are sort of the first successful outcomes that we should see, recognizing that it's always hard to predict these things? And what are sort of the medium and longer term outcomes? What sort of timeline are we looking at to be able to really begin to see a difference?
Good question. And I will say this kind of investment, when you're talking about, like, just as a city having a violence prevention system, is something that we should look at as a need for continued investment, especially as we begin to see what is working, because then if you begin to pull things away, then, we may fall backwards. But more on a short-term level, when we're talking about our intervention strategies, I'll say that we're looking at more short-term, engaging with the individuals that we know are at highest risk of being involved in some type of crime, right? And so with that population of individuals that we know are generating things in the community, we're looking to build protective factors for them to decrease the risk factors, which then gets us at that long-term impact of the reduction of shootings, reductions of homicides, and just reducing how we're experiencing violence in our community. And so when we talk about building protective factors for these individuals, we're talking about building skill sets around nonviolence. We're talking about, these individuals actually embracing nonviolent goals and values. We're talking about increasing them having relationships that are associated with nonviolence. And we are increasing their access to things that are considered basic needs, right? Workforce development, education, mental health, substance abuse, all of those kinds of things, helping these clients avoid situations that involve the risk of violence, and then helping them to deploy nonviolent strategies and conflict resolution and what they're engaging with. And so we're looking at changing a mentality so that we can change a behavior, which is a work in and of itself that takes time. And so when you look at where we can see some of this stuff in the next year, if we're able to say that we have, 100 people or 150 people that we've been able to engage with that were once engaged in one way, they're no longer engaging in those behaviors and are actually, engaging in things that would make them what we would consider productive members of society. I think those are wins. And those are the things that get us to seeing less and less violence. And so on the side, though, of community mobilization, where we're looking to work in community and establish some type of sustainability of a system and network that works within community, we're wanting to create community-based frameworks for violence prevention that are very specific to particular communities, right? Because not all communities are the same, and you have to be cognizant of that. And so as we're developing kind of infrastructure in the community, there is embeddedness there. There's an ability to have sustainability there, which means that we have preventative measures in place in community. And so we don't have to be reactionary in our responses, because that's another kind of gap in our violence prevention infrastructure, is that people collaborate generally in times of crisis. But if we have these systems in place in community that are operating, even when we're not in crisis, when we do get to crisis, we have a way to mitigate that, like we've seen in some of the other cities. While everybody has seen an increase because of crisis, because of the systems that were in place in these other places, there were 40% increases, 30% increases, even in some of our roughest cities. But Louisville saw like a 90% increase, and we just, we have all of these gaps in our infrastructure that we need to address. And so those are the kinds of things that I would say we will be able to produce for you data-wise, for you to be able to see how we're building protective factors, how we're decreasing protective factors to get us to that long-term impact, which is to see a reduction in violent instances in our city.
Yeah, thank you, Dr. Williams. That's really helpful. So I think it's helpful to remember that part of the outcomes are what does our infrastructure look like and assessing how we're actually building out the systems. And then part of it is looking at the outcomes, recognizing that people are complicated and these problems are complicated and there aren't easy fixes here. My last question is just, I'm a big believer in restorative justice as one of those programs that particularly is helpful for youth and justice-involved youth, and as a way to sort of, we were talking about expungements earlier, restorative justice is a way to even stop any sort of conviction from happening. It also sort of increases buy-in with the community and sort of causes individuals who might have harmed the community to have to sort of engage with community and understand that. I'm curious what sort of plans you might have, recognizing that we have no say over what court systems do, but any plans to sort of work with the judicial system, educate them on restorative justice? I know we have the VOA Restorative Justice Grant, but particularly interested in hearing about any planned capacity building around restorative justice and working with the judicial system on that.
So definitely. So we do have, the restorative justice, which is now VOA, that we support through their work and working through how we expand that partnership and support their efforts. And one of those issues is, you don't control the courts, but also too, a part of the GVI initiative is to galvanize those, judges and court systems to be able to have them respond in a way that if, there is an alternative for an individual, that maybe you release them to us or you release them to the initiative for us to begin to work with them rather than the punitive, outcome that may have been. And so that's in the works with the initiative already. And there have been conversations with some of the judges to see where we may have some inroads to do exactly what you're saying.
Well, thank you, Dr. Williams. I hope I can be part of the ongoing conversation. Big champion of restorative justice and would love to talk more about how we can build out that capacity as part of this. Thank you, Mr. Chair.
Thank you. President James.
Thank you, Mr. Chair. Dr. Williams, thank you for being here and thank you for answering all the questions. I believe also that a holistic approach to how we deal with crime is very important. I do have some questions for you. Can you tell us what the status is of GVI currently?
Sure. I don't know if Keith is on here or not, but I know that right now they are in the last stages of identifying, of hiring the new program manager. And then between my office and LMPD, we are working on the customer notifications and the community police response to victims of violence and reaching out to families and engaging. So we're engaging in the initiative right now, just kind of, we just onboarded our outreach case management team that is supporting the outreach and case management needs of that initiative. And so that happened towards the end of April, beginning of May. And so they've been engaging since about the end, the middle of May. I'm sorry, the middle of April.
Okay. Hey, so the custom notifications, that conversation has been going on for a while. Do you know actually start?
So I believe that LMPD has been doing some custom notifications even before we had an outreach team on board. And I will say that we are exploring different ways to do that just because LMPD has a lot right now. And so to add on top of them, like being concerned about the public safety of, us as an outreach group, as we're engaging with individuals who are known high risk, there are differing ways that other cities are engaging with this population where everybody is safe. And so we are talking with those cities about those strategies so that we can potentially deploy those, because we don't want anybody getting injured in a state where right now, even law enforcement is being shot at, and so it's like if they are a target and we're out with them in certain instances, we could potentially be targets. And so we're trying to think through the best ways to keep everybody safe.
Okay, thank you. And then the next question I have is related to your manpower that grows over the year. So you're going to be going from 18, I think, to 27 in this budget. Will there be more after that, or how many people will you have on board actually working for Metro government at that point?
So that'll be it. It'll be to establish the infrastructure. And I mean, I can share, I think we shared the expansion org chart, but for the office to function, those are the positions that are needed. And beyond that, we shouldn't need anything else.
Okay, so everything outside of that will be through contracts and consulting. Is that accurate?
Yes.
Okay. And then I was looking at the one here for Pivot to Peace, and it's got a pretty significant increase in its budget there. Could you explain what that's about?
Sure. So with the initiative and with coordinating the Pivot to Peace initiatives and being able to kind of engage in all of what's needed for all of the strategies, some of the limitations to what we have traditionally known Pivot to Peace to be just has been in their limited ability to do all of the work that's being done and then also respond to the needs of the individuals. And so when we look at the kind of clientele pool for GVI, whether you're doing the public health approach and street outreach, or if you're doing, let's say GVI or hospital-based intervention, they all end up needing the same kinds of things. They're all in a state of crisis, and we have to be able to get them out of that crisis. And a big part of that we're seeing is needing to be able to relocate families. Like we've had to do that already, and we just started. And not even just like, oh, we just, this may be a good idea. My house is shot up, but like people are driving by today and I might not make it or my child might not make it. And so we need to be somewhere else. And so relocation and a relocation program is something that we're needing to build out that's significant within that initiative to support those individuals, as well as being able to support the needs of the outreach team when they go out and what they're sharing with people. And then also to a mini kind of gun violence reduction campaign, because we're talking about social norming and how social norming works. And we're trying to change the attitudes and beliefs around what we accept as normal for violence. And so that's inclusive in there as well.
Thank you. And Mr. Chair, I'll step back and let somebody ask questions and I'll come back in. Thank you, ma'am.
Vice Chair Kramer.
Thank you, Mr. Chair. And Dr. Williams, thanks for being here with us. And Councilman James, President James stole a couple of my questions. So thanks, David, for getting answers to questions I was seeking. There's been several references to GVI as part of our discussion today. Where is GVI in the budget? How are we paying for that going forward as an initiative?
I believe the GVI budget is going to live in OPI. Chief James?
Correct. Yes, we have Keith Talley on board.
Correct.
It's going to be in OPI, and he can talk more to that.
Yes. So that budget will be housed in the Office of Performance Improvement, although the program manager and the program manager itself will be housed in that, but that will be a direct report to me. And so it's a separate piece of that budget that's carved out. It's really just a holding place for it structurally.
So in the mayor's letter earlier today, it almost sounded like he was saying he thinks GVI makes sense, but there doesn't seem to be a whole lot of money in the budget for that. Did I misread the letter?
I'm not sure I'm aware of which letter you're speaking about. Was it for funding strictly for GVI? Because currently I think there's $550,000 in the budget.
I should have the letter in front of me as I say this out loud. And I'm scanning my emails feverishly to find it. He says this is written to the community. It was written to the community partners, and it says, "Thanks for the letter and the comment. The financial support that you provided to engage the national network of safe communities in Louisville for implementation of the group initiative." And he goes on to talk about how pleased we were with how it came out. But it says, "It was our understanding you intended to cover the cost of the work for NNSC team through the second year. In fact, we've been very deliberate in our messaging that the private sector stepped up and no tax dollars were used to fund this technical assistance. Therefore, the $550,000 requested to support GVI in my budget did not include those implementations and technical support costs. Local government was not party to that agreement and would have to seek additional resources to cover those costs." So it sounds like he's saying that's not in the budget.
So here's my understanding. The 550 is in the budget to cover the operational side of GVI. I think the money he's referring to is a contract they had to pay for the consulting fees from Professor Kennedy and the consulting team from John Jay University. And so that's a conversation that's happening a little bit above me, but those are two separate pots. The pot for the operational side of GVI is included in the budget.
Okay. So we'll have to double back to that piece, I suppose, at some point.
I can confirm Chief Talley is correct. That is the nature of the first year did not involve any Metro funding, and it was anticipated the second year would not, as it was an agreement between an outside party and a third party contractor, nor was any request made to Metro prior to budget development.
Okay. So the fact that we're not intending to come up with this 550,000, what does that do to the relationship that we had established? What does that do to the contract?
I think we may be talking.
We don't have that contract with. Yeah, we don't have that contract with the John Jay Center. That's through the outside third party group. So it's a agreement between two parties that are not Metro.
And we weren't a party to that, and the letter suggests that we won't be in the future a party to that either.
We weren't for the first year, and I don't know about beyond the first 2 years, but we weren't in the current year that we're in, and it was not anticipated for the FY22 proposed budget.
Okay. Is it likely, Daniel, that somebody's going to come back and ask us to find a way to pay for this?
As you and council members know, it is common for Metro government to receive requests for funding. But I don't know. I can't speak to it directly.
Okay, thanks. No, I think that was. I think that answers my question. Thank you. And I thank Councilman James for capturing the rest of my questions. Thank you.
Councilwoman Purvis.
Thank you, Mr. Chair. Ms. Brown, I wanted to ask you, I know that President James was asking you about the increase in staff, so I think you did confirm that you are looking to increase the staff from 18 to 27, correct?
Correct.
Do you have an average, do you have a cost or an average of what the salaries would be annually?
Yes. And I mean, what those salaries would actually be would have to be worked out with human resources as far as where we could start people based on what those salaries are. But I could send you something or send out something that with my thoughts relative to the salaries for the positions that would be added.
And have you identified the job classifications?
So we have not done that work yet.
Okay. Would it be possible to get that information as well?
Yes.
Okay. Okay. And thank you. And the last thing I wanted to mention to you, I talked to Chief James about this shortly after Luther Brown passed away. As we all know, he was a big gun safety advocate. And I just wanted to know if Office of Safe and Healthy Neighborhoods, if you were considering incorporating a gun safety program into your operations. If you have considered that, and if so, can you just give me a little information on what that process would be?
Sure. So when we look at, the way that we've experienced gun violence in the last year, we saw an increase in unintentional injuries of young people just with the increase in, guns in last year. So we've been having conversations with Norton Children's Hospital because they were wanting to know what they could do with the increases that they've seen. And so they were talking about some gun safety prevention work and how we could help to support that work within the hospital. And so we're having preliminary conversations there and what that could potentially look like. We don't want to own anything if somebody else in the community wants to own it, but in the best ways of us supporting it through our strategy, we do plan to do that because we've seen an issue with that, right? And then they don't know what to do, especially when they identify when a family is at risk of further injury. Those are the things that we're trying to work through with them.
Okay, thank you.
Councilwoman George.
Thank you, Chair. And I'm not sure if this is best directed toward Director Williams or Keith Talley, but I'm interested to know about who's leading the charge and evaluation for GVI.
So I will say that, you
go ahead.
Okay, I was just going to say that that's one of the things that is in contracts for me as an evaluation of our gun violence reduction strategy in partnership with the University of Louisville, so that we can most effectively look at it and say that, and add to the evidence base and be able to identify and look at what's working and what's not working for us. But that is in the plan. Now there's a template for how to do it, but having someone to actually do it is what we're trying to ensure that we have for all of the strategies.
Thank you, because I know I'm not alone in this when there's concern about just general capacity around staffing. And I also just wanted to make sure I understand, as of right now, we're doing an internal evaluation. Is that right?
Right now, I'm assuming that is the expectation.
Okay. Thank you. The only other question I had was really just a question around how we rank with our peer cities in terms of funding violence prevention strategies.
So I will say that we rank on the lower end of funding violence prevention strategy. I guess years ago we were on the innovative side of creating this office, and now these offices are popping up all around the country. With last year, just 7 offices alone, because people are needing to facilitate strategies for gun violence reduction. The smallest budget with those that we are in network with, as of last year, was $6.5 million. This year it's about $8 million, as they increase to respond. And then, you can look at places that have kind of robust systems in place, like a New York or an Oakland, who have, violence prevention, like legislation and policy, where they pull money from taxes to go towards violence intervention. And they're looking at $22 million, $26 million a year to put towards violence prevention work.
So what I'm hearing is, if we want to see outcomes, we should be evaluating our outcomes, and we should also be willing to pay for them.
I would agree with that.
Thank you, Councilwoman. Ms. Williams, you've mentioned several times that the people that you're in network with, can you talk a little bit about what kind of information and evidence sharing there is going on in terms of sharing information about how this is working in other communities, what other people are doing. We're not alone here, and I appreciate that we're working with other people. Can you talk a little bit about that?
Sure. So we are a part of a couple of networks, and so we have the National Network of Offices for Violence Prevention, and then we have our Cities United Network, which is a network of cities who also have violence prevention offices through their city infrastructure and building out comprehensive strategic plans for violence intervention. And so in both platforms, it's essentially like peer sharing. What's working for you? How is it working? What did and did not work? How are we looking at data and how are we collecting data? How are we showing impact? And we just talk about the intricacies of the work. And try to help each other with the different strategies that are being deployed in most spaces. And I'll say on the side of more so gun violence reduction, which is where everybody is pretty much focusing, we mostly align that kind of base strategy that most cities have that, if you read some of the stuff that was put out over the last year, people attributed the interruption of their street outreach work with, the increases in violence that they were experiencing because their most effective strategy was made ineffective during the season where we couldn't engage. And so we're trying to get us to a space of having some of the basic things that these other spaces have that they're saying are working.
Thank you. And I just think it's important to note that this is not unusual around the country. And I think it wasn't invented here, and we should be learning what's working in other communities and continuing to make improvements. President James.
Thank you, Mr. Chair. Thank you, Ms. Williams. When you were just speaking about what was working and what wasn't working, when you speak to your peers around the country, are there some things that they're doing that they have said that works that you think that we should try here specifically?
So, all of the things that we are proposing are a part of what people say work. And so when you look at the evidence base, there are 4 models for gun violence reduction that seem to work and work in tandem. And so you have hospital-based violence intervention programs. You have the public health approach to violence intervention, which the model that was here previously was Cure Violence. And then you have a focused deterrence kind of model, which GVI falls under. And then you have what are called peace fellowships, which is similar to what we had in our Thrive Fellowship, that looks like engaging individuals who are coming out of the criminal justice system in a fellowship process to get them to a place of stability and positively engaging in society once they re-enter.
Okay. And then I'm going to go back to the Pivot to Peace program. With the amount that is going to increase in that, how many people do you anticipate the contractor employing to help achieve the goals that you're trying to achieve?
How much to a contractor?
Yeah, so I'm believing the Pivot to Peace is who the Office of Healthy and Safe Neighborhoods will be contracting with. How many people do you believe that they will be employing in order to provide the resources that you all will be needing to execute the program?
Let's see. I would have to look at each individual's agency's kind of plan for their engagement. But for those that are already at the table, to whatever degree that they need to increase, I'd have to get that number to you. I have to look at several different documents.
Understood. And then I want to refer to I was looking at who your current vendors are, and there's one for Crossmore School and Children's Home for $201,000. Could you tell me what that is for?
Crossmore Children's Home.
Yeah, Crossmore School and Children's Home, $201,948.08.
Yes, President James, that's a part of our trauma resilient communities. That's one of the agencies that we're funding through the grant that we received from SAMHSA.
Thank you. And then I also saw there's one for $17,000 to Spalding University. Could you talk to me about that one?
I believe that may also be attached to Trauma Resilient Communities Initiative. And the professors there that are a part of the evaluation team.
Okay. And then the University of Pittsburgh?
Same, they're Trauma Resilient Communities Initiative.
And then 7 county services for $124,000.
They're TRC as well.
And then University of Louisville Research Foundation for $164,000.
That may be Pivot to Peace.
Okay. If you don't have it now, we can.
I can definitely get it, yeah.
And then I think those are all the questions I have for now. And thank you for the work you're doing.
Thank you.
Councilman Arthur.
Peace. I wanted to comment on something that I haven't heard a lot of discussion about when we talk about violence prevention, and that's the government being involved, specifically Kentucky State Police and gun auctions. I don't know if you've seen the Courier Journal series, but they identified over 1,000 firearms, stolen firearms, dozens of which ended up in crime. Do you have any programming that addresses this issue in the new fiscal year or in the near future?
I don't think we don't currently, but if that is of interest, and if that is of interest, from a community perspective, then those are things that, we're definitely willing to consider and talk through.
Thank you.
Mr. Chair.
Yes, President James.
I just wanted to address Councilman Ja'Cory Arthur's question there. That's something that's in place by Kentucky state law through our Kentucky state legislature. We don't have any control over that.
I don't see anyone else in the queue. And I appreciate your being here, Ms. Williams, Mr. Talley, Chief James. That will conclude our hearings for today. Tomorrow, we will meet at 4:30, and we'll hear from LMPD about its budget. We have that scheduled from 4:30 to 7. That's the only hearing tomorrow is LMPD. And again, that will start at 4:30 tomorrow on May 18th. Unless there's any other business or anyone wants to speak, we will, without objection, stand adjourned. Thank you. And thank you for your work, Ms. Williams.
Thank you.